So today we'll discuss on the standard safety measures. So standard safety measures, it is nothing but the safety measures which are done or practiced inside the healthcare setting where the patients are being treated. It is known as the standard safety measures. We use the various safety measures to protect the healthcare or to protect the patient from getting into another infection. This is known as the standard safety measures. It will combine the major features of universal precaution and body substance isolation and are based on the principle that all blood, body fluid secretions and excretions except sweat, non-intact skin and mucous membranes may contain the transmissible agents. So under the standard safety measures, the most important thing is to know the principles. The principle is we have to think that all the blood, body fluid means mucus, it may be urine or it may be feces, okay, all the body fluids which are excreted from the patient's body, then secretions, various secretions which are from the mouth or from the nose. So these secretions except sweat we all know, then the non-intact skin, that means the skin with no wounds, then mucous membrane may contain the transmissible agents. So blood, body fluids and secretions except sweat, non-intact skin and mucous membrane should be considered transmissible. Standard safety measures definition: these are the practices adopted by all healthcare workers. They will be followed or they will be adopted by all the healthcare workers, including the doctors, nurses, lab technicians, microbiologists, dietitians. All the healthcare workers will follow these standard safety measures when potentially coming into contact with, when they are coming into contact with what? The patient's blood or body fluids. Any blood or body fluid exposure, they will, if there is any chance of coming in contact with the blood or body fluid of the patient, then the standard safety. So let us see what are included under the standard safety measures. The infection control practices which may be used under the standard safety measures are: first one is the PPE, that means the personal protective equipments. Under the PPE, what all are included? We have the gloves, we have the gowns, protective eyewear, face shields, we have the masks, caps, shoe covers, then spill management and safe injection practices and the safe disposal of SARPs. So these all are included under the personal protective equipments that we'll discuss one by one. First one is the gloves. Gloves, they must be used while doing any procedure by the healthcare provider which is coming into direct contact with the patient. That means gloves should be used everywhere inside the healthcare settings in which they are in contact with the patient. Gloves are divided into sterile and the loose gloves. Okay, for the loose gloves we can use while doing any minor procedure which do not need the aseptic condition. Then sterile gloves should be used while doing the aseptic conditions, like the putting the nasogastric tube or while doing the catheterization and all, while doing any culture of the blood or while doing any culture of the urine. We'll use the sterile gloves. And for routine care like making of beds, then providing the positioning of the patient, giving back care and all, we can use the loose gloves, that is the unsterilized ones, clean, but it should be clean. We should not use the dirty gloves. And we should not, while using the gloves, we should always remember that the gloves which are used while taking care of one patient should not be used while taking care of another patient. The gloves must be changed every time we care for another patient. Then hand hygiene. Hand hygiene is also very important. Hand hygiene, that means we have to wash our hands, or we have to sanitize our hands every time we do any procedure. We have to avoid the unnecessary touching of surface in close proximity to the patient to prevent both contamination of clean hands from the environmental surface and transmission of pathogens from the contaminated hands to the surface. So our hand is the most important cause of transmission for the disease. So we should not touch our hands here and there while providing the care of the patient. Also, before doing the procedure, we have to wash our hands properly while putting on the gloves. Also, we should not think that we'll put on the gloves and it is enough. Before every time we put on the gloves, before putting on the gloves, we should always wash our hands. This hand will act as a agent for the transmission of the disease from another place or another patient, or from the healthcare to the staff, or for the staff to the healthcare patients. When hands are visibly dirty, contaminated, or visibly soiled with blood or body fluids, wash hands with either an antimicrobial soap or water, or non-antimicrobial soap and water. So we should always wash our hands with the antimicrobial soap and water. If hands are not visibly soiled, after removing visible material with non-microbial soap and water, so these are the various conditions that we have to wash our hands. Under the hand hygiene, we have the hand washing. The hand washing is a different procedure. It is a different procedure or technique that we'll learn in another class separately. But now we have to know that hand hygiene is very important, and it is an important part of the standard safety measures that we have to. Then next is the gowns. The gowns should be large enough to cover the clothing which is likely to be contaminated. So we have while using our gowns also, the gown will act as a barrier from the contaminated portion of from the contaminated area to our body. Then mode of moisture resistant. So this gown should be moisture resistant material. Then gowns should be worn for procedure that require the sterile field. So they should be always worn while doing the sterile procedures. Gowns should be changed after giving care to the individual patient after performing the procedure, or whenever the gross soiling occurs, or we should discard the gowns in the patient care area or other areas in which they are used. So these gowns should be worn while giving care to the patients every time. Then while doing the procedure also, if it is a sterile technique, then we should always wear the gown. Then the gown can be changed. It's not like we should not change the gown once it is used. When it is swelled with blood or any body fluid, we can change the gown. Next is a protective eyewear. This protective eyewear will be used to protect our eye from any contact with the body fluid or blood of the. Next is the masks. Masks is again surgical masks. These masks are used to protect the healthcare provider, to protect from any spill to the face area of our face. Okay, when splashing, splattering, or spraying of blood or body fluids are likely, in order to prevent the exposure to the mucous membrane of the nose or mouth. So to protect the mucous membrane of the nose and mouth, masks are used. Then next is a surgical caps or surgical shoes. This shoe covers. Okay, these surgical caps are used in the ICU areas where there is very more chances of infection. Shoe cover are also used to prevent the infection from outside, from our shoes to inside the ICU rooms and all. These are also used in the operation theaters to prevent the cross infection from the outside environment to the inner operation theater environment. Next is a spill management. Spills means while any of our blood or body fluid falls in the floor or any of the environment or the bedding or any place where the care is taken place. In the bed or in the floor, spills may be there. Then how do we treat these spills? These blood spills will not be touched directly. So there are various disinfectants which are used in order to provide the spill. So they must be treated with various chemicals like the sodium hypochlorite, then chlorine bleach, then other disinfectants like formaldehyde. So when any area is contaminated with the blood or any body fluids, then we should cover the area with the liquid disinfectant. Then it can be physically cleaned and decontaminated with the disinfectant. Gloves, gowns, masks, and safety gloves should be worn while cleaning the large spill of blood or body fluid. So we should always wear the gloves, gowns, masks, and all while doing the management of the spill. Next is the injection practices. Safe injection practice. While doing the injection, we as a nurse, we should always wear the gloves. We should always wear the gloves in order to avoid the contamination. We should not neglect our hands while doing the injections. Then we should not administer the medications from a syringe to the multiple patients. So even if the syringes are coming for one use, for a single use only, we used to load the medication from one vial of medicine. Then after giving it, we will load another medication in the same syringe or same syringe. That must not be. Then we should not touch unnecessarily the cannula, the tubings, and all. They should not be reused. Then the intravenous bags, then IV bags, tubing, and connector. They should be used for only one patient only and disposed immediately after the use. In the hospital, we have always seen that after the discharge of the patient, the IV line is still hanging there, but we should not let it happen. We should throw away the IV line or the IV bottle immediately after when it is not used or when the IV line is advised to. Then next is a safe disposal of SARPs. SARP injury with inoculation of blood and other potentially infectious body fluid is the most common route. So while doing the injection or while drawing the medicine from the ampoule, or while doing the opening and closing of the needle cap or syringe cap, this SARP injury are most commonly occur, and it is the most common type of route for various transmissible agents like hepatitis B and HIV to the health workers. We have seen many staffs, many nurses, and many doctors or many healthcare providers which are infected with hepatitis B and HIV only through the needle injuries. So very important care should be taken while doing the SARPs disposal. We should be very careful while handling the SARPs, while cleaning the SARP instrument, and while disposing the SARPs. SARP means not only the needles. It includes the scalpel also. The scalpel which are used to do the minor procedure to the patient, they are also considered contaminated. Then needles also, then instruments, then we are using the after doing the procedure to the patient, the various instruments are first cleaned and then they are disinfected. So while cleaning that instrument, SARP instrument also, we are at risk. And then while disposing of SARPs, these accidents occur mostly while disposing of SARPs. So proper disposal is very necessary, because while disposing, if it is not disposed in a puncture proof material, then many of the housekeeping staffs. Then that means the person who are collecting the SARPs, collecting the garbage bags, they are at high risk of getting the SARP injuries. So they should always be disposed in a puncture-proof and leak-proof container. They should be handled and moved in very careful manner. Then we should always see that the container is 3/4 full. That means if it is divided into 4 parts, if the container is divided into 4 parts, then up to the third part it should be filled. The remaining 1 part should be left empty. It should not be filled up till the neck of the container, because while doing so we might get the injury easily if it is done. Then we should also mark the container. We should also mark the puncture proof container, and we should also always warn, like we should have an indicator for the 3/4. That means we do not fill above the line like that. We have to mark. So these are all about the standard safety measures. Under this we have the gloves, gowns, protective eyewear, face shields, masks, caps, shoe covers, spills management, safe injection practices, and the safe disposal of SARPs. So the standard safety measure is nothing but the practices which are done by the healthcare workers to protect from the infections when they are in contact with any patient's blood or body fluids.